My name is Lynn Arnold. I chair the Don Dunstan Foundation board, and I'm really pleased to be here this afternoon. Unfortunately, I was lecturing all morning in theological ethics, so I couldn't be here at this morning's session, but I understand that the morning went very well. So this afternoon we have a lot more to deal with. First of all, I'd like to start by thanking presenting sponsor Anglicare South Australia, an organisation I know well and love well, for supporting the delicious lunch that you just had. My notes have here, we just had. I didn't get to have any. And while we're on the topic of the lunch, I'd like to draw attention to the fact that the Adelaide Convention Centre support the Adelaide community through their long-standing partnership with Oz Harvest and Food Bank. So if you didn't finish it, others will, which is excellent. Okay, now to lead us into the next session, we have a short video from the Everybody's Home campaign about Australia's housing system. So it should now appear miraculously over my shoulder.
Everyone needs a home, but Australia's housing system is broken. A generation of homeowners has been priced out by speculators. There is a shortage of secure, affordable rental properties. And more people are being pushed into homelessness. But there are simple things our government can do to make our housing system work for everybody. Support first homeowners and renters by winding back tax concessions for speculators. Improve the affordability and availability of rental properties by supporting the creation of 500,000 new homes that are affordable to people on low and middle incomes. Create long-term security for renters with legal protections against evictions, rent rises and negligent landlords. Ease rental stress by increasing rent assistance. And commit to ending homelessness with preventative actions and rapid access to housing and support when people in need lose their homes. When you're trying to find your home, it's easy to think you're on your own, but every home seeker is connected. Renters, first home buyers and people who need a safe roof over their head. What happens to one of us affects everybody. That's why the Everybody's Home Alliance is campaigning for housing solutions for all Australians. When housing works for every single one of us, everyone will be better off. We must force our leaders to fix Australia's housing system right now, because a house is more than an economic asset. It's safety, it's security, it's community, it's a home. Join the campaign today at www.everybody'shome.com.au.
Well, what an excellent, succinct video. First thought was it's very thought-provoking, but when you think about it, it's not thought-provoking at all. It's the bleeding obvious. It deals with the issues that so often fall out of public discussion, and yet when you hear them, you say, of course, of course, of course. And that's what this conference is about, is the of courseness of what you've just seen on that video. And your attendance in such sellout numbers is proof of that. At previous conferences on homelessness organised by the Dunstan Foundation, I've mentioned the fact that we need to address homelessness, not houselessness. And there is this complex issue of the quality of life that is involved if we understand that home is the word, not just house. And that indeed was picked up by that video just then. Well, I'm not the keynote speaker. I'm here to introduce the keynote speaker, Dr. Marah Curtis, our second keynote speaker for today, brought to you by the Centre for Housing, Urban and Regional Planning at the University of Adelaide and the Australian Centre for Community Services Research at Flinders University. You've seen in the documents the description about her background, the work that she's doing. She's involved in the Institute for Research on Poverty, for example. She's also involved in the Centre for Demography and Ecology, as well as working for her work in School of Social Work at the University of Wisconsin in Madison. Now, I was struck by something I read at another conference she's been addressing, because she is very popular, wanted at conferences all over the place. And she spoke about the issue of housing, saying that housing is an essential resource imperative in securing the health and functioning of families. And that really, to my mind, seemed to resonate again with this idea that we're addressing homing as opposed to homelessness, rather than housing as opposed to houselessness. Marah will be presenting about welfare reform, the intersecting vulnerabilities of health and poverty on homelessness, and there'll be some time, a brief time afterwards, for Q&A. And also note that Marah will be a presenter in the next mini discussion round alongside 14 others. So we've got a feast, a smorgasbord of discussion possibilities. So some of you may have the chance to catch up with her there and ask any more questions. Just a reminder again, there'll be a roving microphone for audience questions, and we're also accepting questions through the Slido app. For anyone just joining us now, instructions for the Slido app are in your conference program on page 5. Would you please now welcome Dr. Marah Curtis to the platform.
Thank you. Okay. Thank you so much. It's a pleasure to be here. I have to say that I was speaking at the National Homeless Conference in Melbourne the other day, and there were 880 people there, and there were well over 200 people there. That is 1,000 people in a country of 25 million who are thinking very carefully about housing and homelessness. So for me, someone who thinks about this all the time and for a living, to see this collection of your sector is very exciting and hopeful. So I had a couple charges to do today, and the primary one is to think about housing and homelessness within the US context. But what I've been struck by in my time at the national conference was the idea of context. And so I take some time here to talk a little bit about what is different about the country that I come from, relying on you to then figure out how it's useful to you. So I'm going to have many more slides than I cover because I figured you'll have them. I'm an academic at heart. I can't help myself but give lots of information. But what I invite you to do is to, if there's anything that I cover that is interesting, that makes sense for you and how your structure works, that you want to chat about with me or as a Q&A, please do so. So I err on the side of lots of information because I'm not sure what's going to hit and what's going to be most useful for you. So let's see now. Very good. So I always like to start being very explicit about why I think about housing stability and how I think about housing. And I think about it on a continuum, right? From continuously stably housed to homeless on one end. And there are many different outcomes in between those. And so this is a conference on homelessness, and I will certainly talk about homelessness as an outcome, and I think this is very important. But it's part of this continuum. And many folks who experience instability far short of homelessness at some point might experience homelessness. And what we know from the research base in North America and across country is that a spell spent homeless is quite costly, right? So the ability to avoid a spell can really double gains for a society at large. And as I say here, the vast majority of US individuals and families who at some point experience a spell of homelessness have experienced housing insecurity before. But they may not, in our system, the US system, have come to the attention of any kind of service provider. Right? Okay. I'm a quick speaker, there is a lag, so we'll see how this goes. Okay. Now, the reason why I think about housing, and I think what was just said is that everybody knows housing is deeply important. Nobody's ever going to argue with you. You're not going to say to someone, housing is really important and homelessness is something we should be concerned about. We all know it kind of implicitly in our guts, right? Now, there's a distinction between knowing that in your guts and then talking about the research base, and what we actually know is associative evidence and what might be causal evidence. But the reason why housing matters so much is because it's not just shelter, but there are a bundle of goods and services that come with being housed. So I don't think your system is far different. Where you live defines your access to public services. It defines the schools that you go to. It defines the neighborhood context in which you raise your families and children. So it's not just the roof. It's these entire other services that are attached to where you were housed. Okay? Now we know that this bundle, those different aspects that I just mentioned, are associated with what we need to have labor market success, educational success, and actual physical and mental health. Now, this is a bit about the research base. There is a rather large research base looking at various aspects of housing, whether or not the housing is crowded, whether or not the housing is of high quality, whether or not the housing is stable. Those are the types of housing levers folks think about. And the relationship between access, stability, and the affordability of housing over time. And we know that when there are difficulties in those three different domains, it's associated with both poor health and educational outcomes, inadequate medical care in the US system, hunger and homelessness. Now, because we're thinking across country here, right? I'm talking about data, North American data for the most part. We know the definitions of homelessness vary across country. So you here use the term sleeping rough. The US expanded its definition of homelessness back in 2009 under something called the HERTH Act. The reason why they expanded the definition of homelessness was to enable our continuums of care, those are our service providers in the US, to be able to provide services to those who are not strictly defined as homeless, not sleeping in something habitable, right? So the definition is expanded in order to recognize a group of folks who are experiencing things like frequent moves, evictions, and imminent loss of housing. The purpose of the change of the definition, again, I will tell you, is to be able to extend services to a more broad group of people. Okay? All the definitions, however, both here and in US and other parts of North America, are simply housing that's not stable and secure over time. They share that. Now, I thought I had to talk a little bit about the homelessness landscape in the US so that for all of you listening to this, you can think about what are similar or different than your own context, so then it's actually useful for you. So the US homelessness service sector and the research base often thinks about efforts to predict, and I put that in quotes because I use it loosely because they're not actually able to predict anything, but I'm going to just say that. Efforts to predict who will become homeless are a feature of many programs. And so there are a lot of really smart folks spending a lot of time using machine learning to try to predict who's going to be homeless. I would argue this is not a great use of time. I've said this to folks nicely. Most people don't become homeless. Most people, however, who do become homeless do experience housing churn, things further up the chain, right? Okay. But there is this effort to try to predict who will become homeless as a way to be able to figure out who to give services to. Now, there are very real reasons. In my country, there is a conversation about budget constraints, and we only have so much money to be able to deliver so many services, so we have to prioritize who should get those services. Okay, so those are the efforts for trying to predict or trying to prevent. Okay, in order to prioritize service provision, in order to tailor those services to be best useful, and for prevention. And the last part is to respond to our federal housing agency. This is Housing and Urban Development. This is HUD. So HUD is our central holder of our housing policy. And HUD will decide what the mandates are, and then states will compete for HUD's money. So when HUD decides that they're going to take on a particular faction of homelessness, then the funding goes that way. And so then all of our nonprofits and governments respond, oh, the funding is over here. We're going to do it over here, right? Because it changes. So HUD has been very keen on ending veterans' homelessness, okay? HUD has also been very keen on the chronically homeless. Now, the chronically homeless, I think maybe not unlike here, in the US usually means single adult men, okay? However, family homelessness is a different kind of a thing to think about. And that's the most recent administration's talk. There isn't any new funding, but now there's a thought to think about family homelessness. So what this means is a pragmatic affair. Like many of you said in the sessions earlier today and many of the speakers, there is a lot of variation in folks who are experiencing this condition of homelessness. Okay? A lot of variation. However, what all of the folks who are having a spell of or experiencing homelessness share is this instability in their housing bundle. Okay? So you have that, and then you have funding streams, however, that mandate who can be served and who can't be served, and set up incentives for nonprofits and governments to compete for that to solve one slice of homelessness. So that's how our system works in the US. Okay? Now, so I say all of that to say that particularly you have many academics from other parts of the world and North American academics coming here and thinking about borrowing and sharing. I would just say these few things that I think are really quite important. It requires careful thought and planning to borrow solutions across geography. Okay? For a whole host of reasons, several of which I'll say, housing markets vary dramatically. They vary dramatically within country. Even in the same geography, you can have far different housing markets, far different housing options, and far different housing costs. The housing stock varies in terms of its quality and its size. So if you're thinking about housing folks who have larger families and your stock doesn't cooperate with that, that's something to think about. That doesn't have much to do with the consumer. That has something to do with what your housing market is able to provide. The population categorized as homeless varies dramatically in many ways, except for the experience of housing instability. Okay? And then this last thing that I've noticed very much of late in the context in which I'm working is that the network of service providers, relationships between them and housing providers and landlords in the US context is particularly important. So what's happening on the ground level, I'm working with a nonprofit as an academic partner, and what's happening on the ground with folks who are trying to get people into housing is that there are all these informal meetings happening between service providers and specific landlords trying to negotiate on behalf of clients to get them into housing. Now, this is not something you're finding in the academic literature because it's happening on the ground and nobody's evaluating it, but I've been struck by this informal network way of getting people into housing and then trying to keep them in housing over time. Now, I'm just going to say a few things about money. My policy professor many years ago said something to me really clear. Show me your government's expenditure patterns and I'll show you what you care about. I don't really need rhetoric. I think it's interesting and it can be fun from an American perspective, but show me your line items and what you're willing to pay for, and then I will tell you who you are as a nation. So let's talk about the US for just a second, okay? Most Americans consume their housing in the private market as renters and owners. US housing is a private market affair almost exclusively. We have a very small subsidized segment of housing. It's a very small proportion of our overall housing stock, okay? Homeowners in the US are aided by generous federal tax subsidies to purchase housing via tax deductions and mortgage deductions and exclusions of property taxes. And so what that means, I don't know how your system works here, but if you are someone who purchases a home and you purchase it with a mortgage, you're able to deduct that mortgage interest as well as your property taxes, which are quite high in many parts of the US, from your taxable income. So you make $50,000 a year, you pay $20,000, you're paying taxes on $30,000, right? So it's a really very large subsidy to those who own homes. Now, folks who think about taxes for a living, this makes people itchy because it's inherently not horizontally equitable, because a homeowner and a renter who are alike in all other ways are treated very differently by our tax code. The other thing about talking about tax expenditures is it's kind of a hidden welfare state. It doesn't go through any kind of appropriations process, and so we don't really think about it when we talk about housing as a larger culture, which I think is problematic, right? Okay, so here's just some numbers, because I like numbers. The Joint Committee on Taxation estimated that in 2015, this tax expenditure was $58.8 billion for the mortgage interest deduction and $31.1 billion for the property tax deduction. 60-30, about $91 billion. That doesn't go through any kind of federal appropriations process for owner-occupied housing. Now, so let's look at the other side. What happens with folks who have difficulty affording any housing bundle? This is the subsidized portion of what we do as a nation. In the US, we have the Housing Choice Voucher program, which is in essence a subsidy. It's a user subsidy. If you were to apply for it, you would get it. You'd take it out to the private market. It would hold your rent at 30% of your income. So it's a 30% subsidy. I think about it as 30 cents on the dollar. So it's quite generous. But in our system, it's incredibly scarce. Right? Very hard to get, very long waiting lists. So 1 out of 4 eligible folks get it. When the waiting list opened just recently in, I believe it was Houston, this was ABC News. It was fun to watch in some ways, disturbing I guess is a better word than fun. The waiting lists are open and it just showed pictures of renters like running to get on the list quite literally because it's a lottery and it's a serious subsidy to hold until your rental costs a standard. We spent $18 billion in 2014. It's a country of 320 million people, US. Project-based rental assistance, about $12 billion in 2014. And public housing. So our public housing are standing units. Many of them were built 50 years ago. There's an interesting research base there. Some people have negative things to say about public housing because it concentrates the poor, but the research on average finds positive effects of public housing, generally through the income effect, because it holds people's income constant, and then they have other liquidity to do things like feed themselves, to do other things with it. Okay? So this is just the rest of that. So if a household rents, they purchase their bundle mostly unsubsidized by any tax benefit. Some states in the US have what are called renters tax credits, but they're modest and they're not anywhere on par with what owners of property get. Okay? So if you're eligible and you receive a voucher from HUD, it's administered by a local public housing authority, of which there are 3,000 in the US. However, the 10 largest cities have the largest stock of public housing and vouchers, and so a lot of the action is in the larger cities like New York, Chicago. Okay. So that's, I think, all my structural stuff. I've already said this, the waiting lists are very long, and it functions as a lottery. So my last bit about the fact that housing is really a private market affair in the US and that this is very important, I say this because when we think about families who are experiencing homelessness or individuals who are experiencing homelessness, you have an individual with a particular set of characteristics, a particular set of earnings, a particular health endowment, and a particular housing market and geography they are facing. So these folks present themselves to a market that is competitive, and of which there is quite a shortage of affordable housing at the lower end of the distribution across the nation. Now, there are some parts of our country where that's not quite the problem, but on average, that's the story. You meet markets with your personal characteristics, and you compete in a competitive market to see if you can remain housed. That's the game in the States. So what does that mean? I think about families. What does that mean for low-income families? Well, low-income renters compete in a relatively tight market. So this has implications for renters who have an incarceration history, renters who have poor credit, and renters who have inconsistent earnings. And inconsistent earnings are markedly more common at the low income, the income distribution, because of how our labor markets work. So then you enter into that market, and you are comparatively and competitively disadvantaged, competing with other low income folks at the same pot of housing at the low end. Low-income US families also are disproportionately impacted by incarceration, by evictions, by multiple moves, and by inconsistent earnings. The bit about evictions is relatively new information. So there was a book by a scholar from UW named Matt Desmond. It made a big deal. He also came out of the University of Wisconsin, so it's a very big deal there, right? If you're in the middle of the country, in my country, and things happen, it's a very big deal. So Matt Desmond's book on Evicted, what does he do there? He goes and he talks to low-income renters, mainly women, women of color, in Milwaukee, Wisconsin, which is a concentrated city. And he finds out a story that we didn't know before, which is that there's all this stuff happening at the low end of the market with folks being evicted that's not caught because someone had to go into court records and find out that people were being evicted. So he unearths this churn happening for low-income families of color, on the mother's side. This is a story mainly about women. And then on the father's side, you have a story about incarceration. So if you put those two stories together, low-income families are really having a difficult time. So economically vulnerable families in the US, on average, this is obvious, live in less resourced neighborhoods. Okay? This is across race. However, there is racial variation there that's important to point out. Because of the way residential racial segregation works in the US, poor white families and poor non-white families have access to different neighborhoods. So the way that residential racial segregation works is that if you have poor or working class whites who can find a way to get into a neighborhood, either through a subsidy or other, have access to better public goods. That's not the same story for less resourced families of color. Okay? Now this part I think is particularly interesting. When you think about housing, you have to think about there are all of you in this room, and you all do different things in the service sector. Many of you are working in government, many of you are working for nonprofits, right? So you all have different roles, different responsibilities, and you're different stakeholders, but you all have to play together really nicely to make housing happen, because not one sector can do it. I think that's true across country, right? And so recognizing when you're working with each other that you have different opportunities and different constraints. I don't have too many. Right? Academics don't have too many constraints. I can tell you a lot of stuff, and I can tell you what the data says, but I don't have to make it happen. You all have to make it happen. Housing is an on-the-ground thing. Those of you who work in the production of affordable housing, and those of you who work in the service end of affordable housing. Okay? So when I think about it, a group of actors have to come together to decide on what you're going to do. Are you going to create or maintain stock? Are you going to maintain stock? Are you going to rehab stock? You're going to make new stock. Okay? If you're going to try to do new housing stock, perhaps it's one of the funding mechanisms you talked about. In our system, the main funding mechanism is something called the Low-Income Housing Tax Credit, which tries to incent private developers into the market to develop housing at the low end. The difficulty with the Low-Income Housing Tax Credit, we have about 30 years of data telling us this, that once we produce that housing, to keep it remaining affordable at the low end of the distribution becomes the problem in the US system. And then we subsidize the renters of that through these subsidies. But the difficulty in the American system, which may not be the difficulty in your system, and if it's not, hooray, is that even if we produce the housing, holding on to it so it remains affordable, that's the trick. 30 years of literature telling us, oh, wow, we produced it, but we can't keep it affordable, right? So I hope that's not the problem here. That would be awesome if it wasn't. So you all have to come together and figure out how to do this under income constraints. Is that for me? Thank you. Under income constraints and changing macroeconomic and financial conditions. It takes usually a while in the US context to actually get the housing constructed, right? This last point I think is an important one. There are changing political conditions, but changing understandings of what the problem is. Okay, my country is going through quite a retrenchment right now, right? And it's a war over what the problem actually is. What's the problem definition? So if you think that homelessness is about personal characteristics exclusively, if you think it's about individual failures exclusively, then you're going to think that you need a service answer to take care of it. If you think it has more to do with structural factors like the nature of your housing market or the nature of other processes, you're going to reason to different solutions. So that war in the US context about what the problem is an important one, and I think it's fought continuously through our elected politicians and also through media and through activism. Okay? What you think the problem is the solution that you will get. Now, this is a bit where I'll talk a little bit about the research base. I think many of you probably know it, but I'll cover it very briefly. When you look at the US studies that look at housing instability, what we know across studies is that there are positive associations between housing instability and postponed medical care, increased use of acute services for children and adults, and behavioral problems and reduced academic performance for children. So as instability goes up, so do these societal bads. Now, what is completely intuitive is that a consistent income helps to promote housing stability, is borne out in the literature. So income, the level of family income, is a key factor in both the frequency and types of moves. Not all moves are bad. Some moves are really good. Some moves are about upward mobility, better housing stock, better job. Maybe you're coupling or doing something. So the moving, if you look at secondary data and you see people moving, you can't immediately say that's a bad thing. It could be a good thing. It could be an upwardly mobile story. So we know if we break people out by income, that low-income people are more likely to move for reasons that are not upwardly mobile. They're more likely to move because their housing costs have increased, because their relationships have been dissolved, right? So they're moving for reasons that are not associated with positive outcomes. And here I just give you references because I like references. Maybe they're useful to you, and okay, about the relationship between public housing and some positive outcomes for medical care, dental care, and nutrition. Now, there's been some recent reevaluation of what's called the Moving to Opportunities study in the US, which is folks getting a voucher to move to low poverty neighborhoods, right? And there's been some reanalysis by this guy named Chetty, interesting economist, who collects this data for families that moved with a subsidy to a low poverty neighborhood and looked at the earnings of the people who were children at that point 15 years later, and he finds effects there. So that's an argument about subsidizing the ability to purchase housing in a more well-resourced neighborhood is associated with long-term gains for children in the US context. Now, the last couple studies I'll talk about are about health and housing. So these studies are looking at it the opposite way. They're not looking at, hey, what's the effect of housing on your health? They're looking at it the other way. What happens if you have a health shock in your life? Does this affect your housing? Does this affect a spell in homelessness? And that's a hard thing to get a handle on because for it to be useful in the US context for policy, you want it to be evidence that's strong. So evidence that where you can say there's a causal relationship. So there's a couple studies that I'll talk about that help us with that. These next few studies ask the question, how does health affect housing, and how do results vary by housing market and welfare policy characteristics, right? So what is the direct effect, and then what do these structural environmental things do to that relationship? And can those studies help us think about programming and policy? And so what do we find? Using nationally representative data in the US that is representative of cities over 200,000, so large US cities, we find that poor child health increases the likelihood of both overcrowding and homelessness. And that may also increase the likelihood of having inadequate utilities and generally poor housing quality, right? So again, not health on housing, working in that direction. So in a follow-up to this study, what else we find is that having a child with severe health conditions substantially increases the likelihood that the family experiences homelessness. However, this varies in cities with high fair market rents. Fair market rents are rents at the lower part of the distribution that HUD sets. So these are not high rents, these are fair market rents. Okay? In states with less generous public assistance, we have a rather meager welfare state. I just want to make that very clear. Okay? And if it comes up later, I'm happy to talk to you about the details of that. And among individuals who live in poor neighborhoods. Additionally, we found that if a family received housing subsidies that we talked about, that's at 30%, holding your rent at 30%, temporary assistance for needy families is what used to be welfare. It's a residual benefit, and it's everything is a work benefit. We don't have any transfers in my system that are not work conditioned. The largest transfer to the poor in our country is the Earned Income Tax Credit. It's a wage subsidy. So everyone's a worker now. That's been since 1996. Okay? Supplemental security income is income for those with disability and others. These programs mediate the effects that I talked about. Now, let's just put these studies in context. Most children do not have a severe limiting health condition. The point of the study was not because most children have a severe limiting health condition. The point of a study like this was to say, hey, what if you have this shock outside of your control, right? So we brought in a team of pediatric doctors who looked at health conditions and they coded them. So these are health conditions that are not associated with parental or maternal behavior. I say this very carefully because you're trying to get a causal link, not because I don't think everyone has a right to housing, okay? So if you had a child with fetal alcohol syndrome, that implicates the mother's drinking to the fetal alcohol syndrome. Again, I'm not saying that everyone doesn't have a right to housing. I'm saying if you're looking for a causal relationship between health, then if you have something that's also associated with a negative outcomes, it doesn't help you make your case. So these were health conditions that were not associated with parental behavior. Okay, so that's. The point is to investigate whether or not a shock of that sort, it could be others, would be directly associated with housing independent of the parent's behavior. This is a very big conversation in the US, right? Now, I'm not going to say much about the family options study. I want to put it up here. How many of you know about the family options study? Okay, good. I'm going to say something very quickly about it. The family options study, it may or may not be useful to the Australian context, but it might. It was a randomized controlled trial evaluating homeless service interventions for families with children. So HUD took families and randomized them into different types of care and looked at their outcomes. And so from the US context, this is maybe less so for you, it's a very useful study. And I tell you more about it here, you'll have the slides, but the upshot of this is that when you assign families to these 4 different conditions, usual care being just if a family presented to a continuum of care, whatever they can get. And when a family presents to a continuum of care, about 37% of them do get a voucher. Okay? So if you compare what happens if I just give you a subsidy with what happens if you go into usual care and these other conditions, we find that the subsidy, receipt of the subsidy, is associated with health conditions beyond stabilizing your housing. So I'm going to skip to that because I think this is interesting. These are the 4 conditions, and some of these will be familiar to you. Usual care, long-term housing subsidy, which is the subsidy I'm talking about, community-based, rapid rehousing for up to 18 months, project-based transitional housing, priority access to temporary service-intensive stays. Now, for families, we're talking about homeless families now. A lot of folks, homeless providers in the US, think people need things, and they're very attached to these ways of delivering services. The results didn't bear it out. Okay? So if you compare what we find Each option typifies an approach to housing homeless families based on both explicit and implicit theory about why families become homeless. Therefore, the most effective service model. Again, back to problem definition. What problem you think you have is the policies you're going to develop to deal with it. So in the US context, what do we find? The biggest difference is, when you compare outcomes between those with priority preference for a subsidy versus usual care, is the clearest examination of subsidies on the well-being of homeless families. Again, families. It could be different for individuals. This is what we find. At both 20 and 37 months after random assignment, household heads reported a decrease in psychological distress, a decrease in intimate partner violence, a reduction in the number of schools the focal child attended, and a reduction in the proportion of families that reported food insecurity. Okay? So this is strong evidence, and it's an underestimate, because as I said, the comparative group, those who got subsidies and those who got usual care, of the usual care group, 37% of them got subsidies. So that means that your results on the subsidies are a lower bound estimate. So what this says, writ large, the US body of research, is that subsidies for families at least seem to provide serious stability and other outcomes besides stable housing that we hadn't been capturing before. All right, I think I'm gonna, are you giving me a 0? Am I done? Oh, good, okay, all right. I don't wanna say, that's it. I wanna say, I have a bunch of slides, but I'm not gonna say all of these things. I guess I'm just hopeful that in the time that we have questions, things that I said about my system, about how it works in the US and the research base, I want to entertain those things so that it's useful for you that I'm here. You know, I mean, I'm not going to presume that what's going on in North America is the entire universe, right? But research is useful. So you tell me what you want to chat about. I don't have any more slides. I mean, that's...
Thank you very much indeed, Marah, and indeed the full set of slides excuse me, will be put on the website, and the presentations are being filmed, so you'll be able to re-see it and then watch the full set that Marah took us very quickly through some of them.
Sorry.
Fascinating amount of information there. You talked about we draw out of that what is relevant to us, what is not relevant, or what suddenly triggers in our minds something which, yeah, we don't have quite that situation, but now that you've raised it, I now think about a corollary in this country. You mentioned that $91 billion is spent on helping people buy houses, and that only something like $37 billion is spent on the other side of things, of which only $7 billion is on public housing. Well, our corollary for that, I guess, is negative gearing helps people who don't live in the houses. That's where a lot of our tax money is going, but the same sort of outcome out of the whole lot. You talked about what you think the problem is, the solution you will get, and I really found that a powerful statement, because the way in which you address it, what the it is that you're addressing will colour what's happening. You mentioned the race issues in housing. There was a very telling article in the New York Review of Books a few months ago that talked about the impact of public housing programs when they were started, really, in the 1930s, exacerbated racial divide, not minimized it. Now, again, that may be a different context here, but we have other race-related housing issues that we need to very seriously think about. You talked about the impact on postponed medical care, use of services, and then spoke about an example, what happened when the reverse took place and the significant reductions in the stresses and pressures that were being faced by families. And then that interesting study of the interaction, the two-way path of health and housing. You know, we normally thought of it as a one-way street, but you suddenly raised an issue of a two-way street. There are many issues that you've raised, and I now invite some questions before we move into the next phase of the agenda. Are there any questions? And there's a roving mic that will be there for you to respond to. Now, I'm looking in a bit of a blinding light, so I can't necessarily see if there are hands raised. Any questions?
I might start one from Slido then, Lynn.
Yes, Slido has a question.
Yeah. How can we ensure fair and equitable services for all when social housing demand is at its peak?
Okay.
Really? You're going to ask the American about what to do in your fuller welfare state? Whoever asked that question, what do you think? I mean, right? I'm not going to pretend to have answers to things I don't have answers to. When I come here, this is my second time here, you have a much fuller welfare state. That's an important thing. We are having a retrenchment in my country, and it's quite disturbing. And there's quite a lot of housing disruption pretty far up the distribution. I wouldn't immolate it.
The question down here.
Can you talk a little bit about when the global financial crisis happened and we saw on our news services all these mortgage foreclosures in America and all these empty houses, and then we were told, we could buy them for, $10 or something ridiculous. Can you talk about that in terms of whether that was an opportunity for people to get homes or not?
Well, it's interesting. This is not something I study formally, so don't take this as formal knowledge. There have been certain cities in the U.S. that have been particularly hard hit that have not recovered. So what has happened? I can tell you what has happened. Certainly, whenever property becomes inexpensive, that is an opportunity if you have the capital to buy it. So what has happened in a neighboring state, in Michigan, Detroit, Michigan, is that there were a lot of houses that were foreclosed, but they have been purchased by conglomerations who purchased the housing and then let it out for rental. And so what folks are saying in those neighborhoods is that there is a reduction in owner-occupied housing and a reduction in the community investment in that housing. So there are some restructuring things happening in the American housing market because of the collapse in prices and who is able to purchase that. So I think it is an opportunity, and there have been some pockets of nonprofits and land trust type approaches to getting that housing and holding it. But it's a free-for-all. It's who can get access in the credit market, who has the capital to do it.
Another question down over there, is there? Right there, and then one down here, and then we might have time for another question after that, and then we'll have to go to the next session.
Thank you. My name is Lily McLaughlin. I work with the social support group Random Acts of Welcome. I wonder if in your country you have the same problem that we have, where our government has just taken the income away from 15,000 refugees, and now these people not only have to, out of Centrelink, pay for their visa processing, but they also get fined by Centrelink if they don't turn up for meetings with Centrelink, even if they're in hospital because they try to commit suicide. Do you have those type of problems? Because to me, this is one of the biggest problems we've got, and it's an unknown that's now being added to our housing problem.
Certainly we do. The context of it is a bit different. So what is happening in the US, we have so the eligibility for benefits by immigrant status is very different. You're not eligible for benefits. The 1996 welfare reform took into account immigrant status and didn't give benefits because of what we have happening with anti-immigration laws and that are being challenged in the Supreme Court are a loss of a whole host of, not benefits, because there weren't benefits given before. So it seems the ethos in the country here is different, so I would imagine that one has to push back against it. But certainly, so for citizens in the US, at the state level, there has been an attempt certain states have tried to put drug testing in our SNAP, which is our food security program, Supplemental Nutrition Assistance Program. That's gotten some traction, even though the data shows that there are not differential drug use patterns by income. So this is what's happening in the US. It varies by state and it depends on who the governor is. So there is that sort of mechanism happening in my country.
Another question there?
Yes.
May need to be
here, and I think perhaps in Europe too, depending on your political position, there are contrary arguments made about immigration, including refugees who settle. One argument is that they put demand on housing, and this pushes up the price of housing for everybody else. And contrary argument is that they provide labour, including skills and filling in shortages, which builds more houses, which pushes the prices down because there's more supply. Is there anything in America which tells us about that?
Well, there's a body of research that I can refer you to, but it's, again, not my expertise, which looks at, it's generally economists, which looks at immigration rates and the effect on native-born wages. And there's one really good paper that looks at uses the Cuban refugee crisis as a natural experiment and what that did to the Florida housing market. That's a great paper. So the answer is yes. There are economists on both sides of the argument, and it's an empirical question, and it comes down to the data you have and whether or not you can measure it. I think that the empirical question is separate from the cultural war questions. I think there are some papers that find a small effect of the proportion of immigrants and reductions in native-born wages at the very low end, and then there are papers that refute that and say this particular scholar's name is Borjas, that his data isn't any good. So you can read the arguments in the papers. Those are separate from the cultural wars, which are what are happening in my country now.
Okay, I think there are no more questions at the moment. This may be the good time then to wind this up. One of the other things that I was struck by, Marah, that you spoke about was the trap with low-income families with incarceration, eviction, multiple moves, inconsistent earnings. You then tied up evictions as a mother's story and incarceration as a father's story. A couple of years ago, we had a committee set up by the state government, the 10 by 20 committee, looking at reducing recidivism. And one of the key issues, and because we have high rates of recidivism amongst those who had been in prison, one of the key issues was housing, and housing in the complex bundle issue approach that you're taking. And how we can deal with that, especially when there's then a bit of a narrative in the community, well, why should they get favour with housing needs when there are others who haven't gone to jail? And so you had that kind of thing coming, intoxifying the debate. And one other aspect that was also concerning, you talked about in America being a father's story versus a mother's story. The rate of incarceration of Aboriginal women is higher than the rate of black women in the US. And that's something which has its own story, which this country has to come to deal with. Ladies and gentlemen, would you join me, please, in thanking Dr. Marah Curtis for her presentation?